Hello and welcome to my report, EastMojo's daily evening news bulletin update. We bring you the latest and biggest happenings from East and Northeast of India. I'm Simran Bajaj. I'll be your host for today and I'll also be giving you updates from Assam. We're being joined by our state correspondents. We have Irani Sonowal Lapcha from Arunachal Pradesh, Vangamla Salikapai from Manipur, Medulino Ambrosia from Nagaland, Chandan Pandey from Tripura, and Princess Giri Rashid from Meghalaya. So let's start today's show. First off, let's go to Sally from Manipur and let's get the latest COVID-19 updates.
Thank you very
Sally?
much, Simran. Thank you so much. Yeah, let me begin with a COVID update. Yesterday, another 59 new cases has been detected. So out of these 59 cases, especially in Tobal district, a lot of people without travel history has been detected for COVID-19. So yesterday also, out of the 59 new cases, at least 5% from Tobal district and one from Imphal West were tested positive without an immediate travel history to other states. So yesterday, out of these fresh cases, not only the 6 cases with no travel history, but even 12 CISF personnel who had recently arrived in Manipur for giving an additional security assistance to the chief minister has been tested positive. But thankfully, these security forces are yet to join they are yet to deploy at the chief minister's secretariat. They are, at the moment, they are at the one of the quarantine center in Imphal. So yes, thankfully, even though they have tested positive, especially those security forces which has been deployed at the chief minister's residence right now are yet to be, they are not tested positive. So among the 59, 12 CISF personnel has been tested positive. Along with this, another 6 patients which has been, not a COVID patients, but different patients which are undergoing treatment at the RIMS hospital were tested positive. So one of the patients happens to be the cousin brother of the health minister, Jayanta Singh Kumar's cousin brother. So soon after the report that one of his cousin brothers, since he also stayed at the health minister's residence in Imphal, right after his cousin brother tested positive, he called all his immediate family members, relative, and all his staff stationed at the official residence. So all of them were undergoing tested for the COVID-19. Thankfully, the health minister were tested negative, but out of the family members, another 2 more were tested positive. So in total, 3 family members from the health minister were also tested positive out of these 59 new cases that was tested yesterday. Along with this, there were also 3 family members of the specific doctor which was tested positive in the Senapati district. That was on Saturday. I did a story about that. His immediate family, because this doctor happens to be from Tobal district but posted in Senapati district. So his immediate 2 family members were also tested positive, and they were among the 59 new cases yesterday. And even on Saturday, one of the staff which is deployed at the COVID control room, which is at the CM Secretariat office, was tested positive. So soon after this staff tested positive, the CM Secretariat has already been declared under containment zone. Along not only the CM Secretariat, but even the Manipur Police Headquarters, which is nearby the CM Secretariat, has been under the containment zone. So far, this is the new cases which has been detected. Now, since the new 6 patients which were detected at the RIMS hospital, because of this, all of these RIMS staff and the patients, I know all the caregivers at the patients has to go under COVID testing for this. So today, the medical superintendent of RIMS have already announced that the RIMS hospital would be, temporarily closed till the 29th of July. So this is one of the case. Moreover, not only RIMS hospital has been closed, but even the Topal district hospital, because since I had earlier mentioned that a lot of fresh cases has been coming in from the Tobal district. And yesterday, at least 2 or 3 doctors and 1 staff from the Tobal district were also part of the new cases that has been detected. So even Topal district has been closed for the time being. Not only Tobal district, even Senapati district has been closed since Saturday. So yeah, a lot of couple of district hospitals, not only the RIMS hospital has been closed. So these are the new fresh cases that has been detected. And moreover, according to the health department, a lot of contact tracing has been done, especially they are focusing on the Thopal district. So the contact tracing has done, and they could at least trace down 6,475 from the specific district itself. Out of these, 10 new cases were detected yesterday. And the rest of the cases, the rest of the samples, they are waiting for the result as well. And remember, I did one story from Churachandpur district where a local, privately run lab employee had tested positive. That was on Friday. So soon after that, this lab was also on the containment zone, and another, sorry, another 9 staff of this specific lab had undergone testing, but they were thankfully tested negative. So now, out of this lab, which has detected on Friday, they traced down at least 574, including the patients who had visited this lab during the period. So out of this 574, so far, 143 people have received the result, which has been showing as negative. Rest of the samples, they are waiting for the result. So these are the latest update when it comes to COVID-19. Now, let me also mention about the total COVID patients, total confirmed cases in the state so far. It stands at 2,235. This is the total confirmed cases. Out of these, 714 are the active cases right now, and 1,521 are the recovered cases. Simran.
Thank you so much for that update, Sammy. And now I would like to head on to Tripura and get the latest updates from Chandan. So, Chandan, there's a 3-day lockdown. Can you tell us more about that?
Yes, Simran, thank you. So, Tripura government announced a 3-day lockdown, and this is not. There was also a question raised by the opposition parties that why the government has all of a sudden imposed a 3-day lockdown without giving any scientific reason behind it. So, the government has said that these 3 days, a government has basically done what they have started a door-to-door campaign, a survey, particularly if I say the health workers, including Anganwadi workers, ASHA workers, they will visit door to door across the state in each and every village. They will visit the house. They will get the people's name enrolled in a list, and they will also inquire things like if anybody has a travel history or anybody at their home is having some other disease or he had visited a hospital to get treated for some other disease. So their name will be enlisted, and soon after that, in within these 3 weeks, people having symptoms and especially those who are above 65 years age and women who are pregnant at the moment, they will be tested by rapid antigen kit. So once they are tested, the government's aim is that they want to know that what is the total number of people affected in our state. Although we know now, at present what the government is doing is anybody who is visiting the hospital or anybody having the symptoms, they are being treated, or the contact lists are being traced and then tested. But now the government has taken a decision. We have also done a copy earlier where I had mentioned that the government has taken a target of 2 lakh 10,000 samples test in a month. So this is a part of it, although it was not disclosed earlier. So now the government will do, they will test each and every person having symptoms, having travel history and other disease. So once they are tested, the government will have an figure, they will have an idea about what would be the total number of figure that people might be infected in our state. Although the government has not accepted that there is a chance of community spread, but they are indicating that yes, there are some in some parts like in the bordering areas and vernacular areas where the people are working like in the front line hospital and daily laborers, they might be infected. So now once they are tested, the government will have an idea of the total number of people who are active so that they can be treated in the COVID care center. The government has also identified a number of COVID care center because at present we have around 1,600 people undergoing treatment in across the state. So once the fresh case gets detected in the COVID care, they will be shifted there and the government will start treating them. So this is why the government had announced the 3 days lockdown. However, essential services like there have been starting from the lockdown one that the government of India had given, all the relaxations have been given, and people can come out of their house only if they have some emergency work. Other than that, nobody is allowed to step out of their house. Simran.
Thank you so much for that update, Chandan. Now, also, could you please give us the latest COVID-19 figures?
Yes, before I do that, also to inform you that the total number of death figure in the state has now increased to 13, which was 11. So yesterday, two more person died fighting COVID-19 virus. So of these two-person, the first death was reported in Gomoti District Hospital, which is around 40 kilometers away from the capital city. The person was 82 years old, 82 years old, and he was taken to Gomoti's hospital. He was having some kidney problems, so as per the protocol now whoever gets admitted in the hospital he has to be tested by antigen kit. So his sample was collected, he was tested positive. Soon after that the hospital, Udaipur hospital, referred him to Agartala, but before he could have been referred to Agartala he died there in uh, Gomati hospital itself. While the second case was reported in a private hospital in Agartala, he was having some lung issue and he was undergoing treatment in that private hospital since July 24. However, he was tested yesterday in the afternoon. His sample came positive. Before they could have shifted him to the COVID hospital in GBP, Agartala, he died there in ILS hospital. So now, two persons had died yesterday, with which the total number of death in our state now stands at 13. Also to tell you that so far Tripura has tested yesterday 37 more people had tested positive, which is good in compared to the number that we have been registering in last 10 or 15 days, which was over 100 and 200. So now the confirmed case in Tripura stands at 3,919. We are almost touching 4,000 mark, and the active case now stands at 1,526, while the recovered case stands at 2,362. Tripura's recovered rate right now stands at over 60%, which is quite good in compared to other states. Although the recovery rate was once over 80, it was 82. So now with the numbers increasing, the recovery rate has slightly reduced, but it is in compared to other states, it's in a good position now. The number of patients who have migrated from the state stands at 18. So this is the number of COVID details. So this is all from Tripura. Simran.
Thank you so much for that update, Chandan. And now I would like to give our viewers the updates from Assam. So before we touch the COVID-19 updates, I would like to give our viewers the updates from Assam floods, because at the moment the state is dealing with two crises. One is COVID-19 and the other is Assam floods. So today's figures are not in as of now, but as of this morning, Assam floods have already claimed more than 100 lives. Yesterday, 5 people had died, and with that, the death toll of Assam flood stands at 102. And at the moment, over 25 lakh people are affected across the state, and a significant portion of Kaziranga National Park is under floodwaters. And so far, 129 animals have been killed in Kaziranga National Park, which is a UNESCO World Heritage Site. And the overall situation in the region, in the northeast region as a whole, is likely to further worsen, because heavy rainfalls are being predicted for the next 72 hours over Arunachal Pradesh, Assam, and Meghalaya. So we're likely to see more water and more damage coming in due to floods. And so giving you details of the 5 person who died yesterday, since we do not have the updated report from today from Assam State Disaster Management Authority as of now. So two each were from Borpeta, two from Kokrajhar, and one from Morrigaon district in Assam. And talking about the rivers flowing above the danger mark. So Brahmaputra River is flowing above the danger mark, a danger level in Jorhat, Sonitpur, Gwalpara, and Dhubri district. And Dhansri River is flowing above the danger mark in Golaghat, Jiaburali River in Sonitpur, Kopli in Nagaon, Beki in Borpeta, Kushiara in Karimganj are also flowing above the red mark. And when we're talking about the worst hit district in the state, that is Gwalpara is the worst hit, with over 4,70,000 people affected by the floods, and 289 villages under 4 revenue circles have been affected of the district. And altogether, 45,912 people are sheltered across 457 shelter camps, relief camps across the state. And also, when we're talking about the rescue work carried out, so the National Disaster Response Force in operations carried out has rescued 80 people from floods on Sunday, and another 30 animals were rescued by NDRF on Sunday. So that's the update that we have in terms of Assam floods. Now talking about the COVID-19 updates. So yesterday, as per the latest updates from last night from the State Health Minister, Dr. Himanta Biswa Sharma, Assam has reported 2 new deaths yesterday. 985 people have been discharged, and 1,142 new cases were reported from Assam. And with that, the cumulative figure for Assam of the total reported cases is 32,228, out of which 24,040 people have been discharged. 8,106 people remain as active COVID cases. 79 deaths have been reported from the state, and 3 people have migrated to other parts of the state. Now, when we're talking about the new cases that have come yesterday. So out of that, only 171 are from Guwahati, 188 from Kamrup, and 100 from Darang. Now, if you see the number of positive cases that has come out from Guwahati, it's only 171. Earlier the figure was touching during the lockdown that was imposed in Guwahati, and prior to that, the figures were always above on the higher side of 400, 700 on that side. So this is definitely a good news for Guwahati. And yesterday, in the past 24 hours, as informed last night, 20,542 COVID-19 tests were carried out, and Assam's positivity rate, as in the number of positive cases per 100 tests conducted, has definitely gone down. It has now reached to 5.55%, which is a very good news for the state. Now, that's about the figures. And when we talk about other updates, so today Assam has operationalized another VRDL lab. So that is in Jorhat Medical College, in the campus of Jorhat Medical College. And with that, Assam now has 17 VRDL labs. And if we compare it to January Assam had none, and now it has 17 labs. Last week, 3 new labs were inaugurated, all in Guwahati, in and around Guwahati, and this is the 17th lab that has been operationalized today. And with that, definitely the testing capacity of Assam is definitely going to reach a new high. So that's the COVID-19 updates from Assam. Now let's head on to Meadow from Nagaland, and let's get the latest COVID-19 updates.
Thank you, Simran. So today, 45 new cases of COVID-19 reported here in the state. And with that, our state's tally has spiked to 1,384. Now, out of this 45 new cases that we are reported here in the state, the Health Minister, Espang Newpom, informed that 23 are from Kohima, 14 are from Dimapur, and 8 are from Mon. So, if we see clearly the new cases in these 3 districts, besides the rising numbers, these 3 districts are now under total lockdown. Kohima's total lockdown came into force on July 25. Dimapur 8-day lockdown came into force yesterday, and Mon's 1-week lockdown comes to force today. So the new cases that we see are also from these 3 districts. And besides, COVID cases in all districts, Kifiri district has so far managed to remain a COVID-free district with no single positive case of COVID-19. Also, we yet to get the latest update for today, but besides the 45 new cases, the state has been reporting new recovered cases on a daily basis. So we're yet to get an update on if there has been any recovered cases in the state today. But as per yesterday, we have a total of 548 recovered cases. So in addition with the new cases, our active case is now at 831. And also the death cases has risen to 4 officially, which is supposed to be 5 latest by today. We are yet to get the official update. As I mentioned, till yesterday it was 4 deaths. However, these 4 deaths are also under investigation. Also, Simran, as I speak about the death cases, I just wanted to give a little flashback of what has happened over the weekend. So on Friday, we have reported the first case, that case where a person who passed away had tested positive for COVID-19. So it was a 50-year-old man who was admitted to the hospital at Medzipema, and then this person had tested positive on the RT-PCR. The person passed away on July 19, but the RT-PCR sample result which declared him as positive for COVID-19, was declared on Friday. So he is the 50-year-old man happened to be the first reported death case in the state. Also, that was on Friday. Now on Saturday, we have seen a report as we've reported also 3 more persons who have died has tested positive for COVID-19. Now, in this among these three, one is the 32-year-old woman whom we have talked about in one of our previous live show, where the 32-year-old woman was found dead at a paid quarantine center in Dimapur. So the lady came from Assam, and she was for about 5 to 6 hours. She was in Dimapur at a paid quarantine facility where she was found dead. So the woman passed away on Wednesday, and her sample results, the RT-PCR sample results, which declared her as positive for COVID-19, was declared on Saturday. And besides this 32-year-old woman, a 72-year-old man and a 78-year-old man, both of them were also declared as positive on Saturday. The 72-year-old man had passed away on July 14, and the 78-year-old man has passed away on Friday. So the three reports came on Saturday, and this has taken the state's tally of the death cases to 4. Now, yesterday, after the daily bulletin updates, which normally is is out by 3 o'clock but reaches us late, we had the information, a confirmed case that one of the COVID-19 positive patient who was admitted at the civil hospital in Dimapur passed away. So this 82-year-old woman, in press reports, if we see there was one person who was critical and in ICU on ventilator. So this 82-year-old happened to be the one and has passed away on Sunday, and was this COVID patient. This has taken the state's toll for that toll to 5. However, we yet to get the official update for the 5th fatality here. For the rest, for the Health and Family Welfare has informed that the cause of death is under investigation, as because they all had comorbid conditions. So the cause of death is under investigation, and the link, whether it is due to COVID-19, is yet to be established. Very quickly summing up again, we have reported 1,384 COVID-19 cases, of which currently there are 831 active cases, 548 recovered cases, and 4 official death cases, all of which are under investigation, and the 5th one likely to be updated by the concerned department this evening. Simran.
Thank you so much for that update, Meadow. And now I would like to go to Irani from Arunachal Pradesh and get the latest COVID-19 updates.
Yeah, hi Simran. So if we look into the data which we have, it's till yesterday night 9 p.m. So as we all know that the capital complex is still under complete lockdown because of the rise in COVID-19 cases. Till yesterday, the capital complex has 337 active cases and 286 have already recovered. But there is a very interesting thing which I want to tell the viewers, that Changlang, which had a very sudden spike in the number of COVID-19 cases previously last month, now has only 32 active cases with 103 recoveries, which is a very good news for the state. So after the capital complex, Papumpare has the highest number with 61 COVID-19 active cases. So if we talk about the total number of active cases in the state, it's 650 and 505 individuals have already recovered. And with 3 deaths, the state tally is at 1,158. Simran.
Thank you so much for that update, Irani. Now I would like to head on to Princess from Meghalaya. Princess, can you tell us about a 3-day lockdown to be implemented in the state?
Well, Simran, it's already been reimposed here in Shillong agglomeration. The total lockdown, which has been reimposed here in Shillong urban areas. Now, the reason for this was that there's a sudden spike of COVID-19 cases, specifically in one district, that is East Khasi Hills district, and just from East Khasi Hills district, we have a total of more than 400 active cases in East Khasi Hills district, which is quite alarming. If we compare to other districts, it's very low. And apart from this, also, this reimposing of total lockdown, the government aims to carry out a contact tracing, because last week itself, a very elderly woman who was above her mid-60s passed away, who had succumbed to the virus. And now the government is at a huge task in carrying out a contact tracing, because she had a food stall in one of the localities here in Shillong. Now the government is afraid that she may have been exposed, many people have been exposed to this virus, because she had a food stall and many people had visited. So with this also, what the government has done is that many containment zones have also been declared in many localities here in Shillong. And just for today itself, also, we've seen earlier till last week, the containment zones in Shillong were somewhere around 22, but today the total localities that have been declared as containment zones is more than 30. So what we're looking here is that, the question now arises is that will the government be able to control this the signs of community transmission that they are looking at? Because the government, though they're saying that community transmission is still not there, but then if they're looking at it, seems like the signs is there, because they're seeing that people are like this lady, they're still not able to find out how did she get the virus, though they're assuming that it's either one of those people who had attended that the wedding fiasco that we've been speaking about for the past weeks, that was at Khanapara, the Greenwood Resort. So either one of those from there who had tested positive from that locality may have been the person from whom she got the virus. So we're seeing that this 3 days total lockdown will end on Wednesday midnight. Simran.
Thank you for that lockdown update. Now, can you guys give us the total figures of the COVID-19 cases in the state?
Yes, the figures that we have for Meghalaya, the total active cases, as these figures are just for till 11 p.m. Last night. We're yet to receive the fresh figures for today, but till yesterday, till 11 p.m. 26th of July, they had recorded 19 active cases, which brings the total active cases in Meghalaya 543. And we have also seen good signs of recovery cases. So the new recovered cases still, yes, yesterday there were 38 new recovered cases just in one day. So now the recovery cases have shot up to more than 100, which is a total of 173 recovered cases and 5 deaths in Meghalaya.
Thank you so much for that update, Princess. And now I would like to give our viewers the updates, COVID-19 updates from Mizoram. It will be a quick and short update. So as per the latest updates available from yesterday, no new cases were reported in the state, but 10 people were released. 10 COVID-19 infected patients were released. So with that, the total number of discharged patients in the state has gone up to 193, active cases to 168. And fortunately, Mizoram has not yet reported any COVID-19 death. So the total figure stands at 361 total reported cases for Mizoram. And with that, we come to an end of today's show. And I would like to thank our viewers for their constant support and for watching us regularly from Monday to Friday at 6 p.m., where we bring the latest updates from the region and from East India as a whole. And if you have any ideas, suggestions, or any opinion that you would like to put forward, you can send it to us. You can send that via mail at editor@eastmojo.com. We also have a very active fact-checking team. So if you come across any photograph, any video, or any other piece of information that looks unauthentic, please send it across again at our email ID, that is editor@eastmojo.com, or you can even send it to us via Facebook. We will definitely fact check the piece of information that you've sent to us, and we will definitely get back to you. And all the stories that we have discussed are already live on our website. You can log on to www.eastmojo.com and please do read them. Thank you so much. This is Simran Bajaj signing off for today.